Have you ever been in a situation where you are a clinical student, you are a nurse student, you're a clinical officer, a medical officer, you're in a setting and the police brings a very aggressive patient to you? What would you do? Stay tuned and we'll find out today, right now. Briefly tell us what violence and aggression means.
Okay.
Yeah.
So violence and aggression, this is a psychiatric emergency. Like a psychiatric emergency is a situation or a condition whereby it needs immediate attention. Okay. If you have not attended to that situation, it is either going to cause harm to the patient or it is going to cause harm to others. Okay. So violence and aggression is a psychiatric emergency. Okay.
Okay.
Yes.
It's a psychiatric emergency.
Yes.
And if not attended to, can cause harm to the patient or to the people around. All right. Hello, viewers. Please, if you have not subscribed to the channel, please subscribe and comment, like. Thank you. Now, what are some of those mental health conditions that could lead to violence and aggression?
Yeah, there are so many conditions that can lead to violence and aggression. For example, this is when the condition is acute. For example, we have bipolar affective disorder. This is where you find a patient is brought by maybe the police, maybe the relatives. They can be tied, okay? And you find someone is very aggressive, someone wants to fight, okay? They are talking a lot of things and they have a lot of what? Of energy. Then another thing, we can find them with people who are abusing substances. Like they can break down mentally, and you find someone coming very aggressive, very violent,
Yeah.
and even that no one wants to come closer to this what?
To them.
This
yeah.
condition. But also violence and aggression can come in other conditions. Like can even be a medical condition, maybe diabetes, maybe the sugar levels are very high, and someone becomes what? Aggressive.
Can stress also be among them?
Stress is not a medical condition, or it's just a symptom.
Okay.
Yes.
All right. So okay. Now, in a clinical setting, how would you handle that situation? A police brings for you a patient very aggressive, and there you are. What would you do?
Yeah. First of all, when you were a clinician, you were a medical officer, you were a nurse, and they are brought for you a violent patient.
Yeah. What is the first thing you do?
Yeah. The first thing that you have to do is you have to ensure safety. Okay.
Yeah.
In our psychiatric setting, you have to sit near an exit.
Yes.
Yes, you have to sit near a door where you can escape, because this person can be violent and what? And harm you. Okay. So we have to ensure that the environment is safe. Like there are no sharp objects which are there. Maybe you have syringes, you have needles are there. The violent patient can what? Can hit you with those what? With those things. So we have to ensure, first of all, we have to ensure the safety of the patient and also safety of the other people around.
Okay.
Okay. That is what we do. But basically, when you receive a violent patient, when you are ensuring those things, because it's an emergency, the relatives want you to manage this person, the police wants you to manage this person. So what you exactly have to do is that you have to take history. This is an emergency. You have to do history taking. But this time you are not going to do it in this one where you sit and take enough time.
Not a lengthy one.
Not a lengthy one. This time, you in your mind as a medical worker or as a clinician or as a nurse, the first goal in your mind is to calm down the situation. Okay. So as you are there, the person is talking and wants to fight. In your mind, how can I calm down this patient? So in that, as you are taking, of course, you have to take history to find out what has made this person to be violent, why this person is aggressive and fighting. But in most cases, in the psychiatric setting, when people are brought to the mental health hospital, we have to rule out what we call epilepsy. Okay? If the police are the ones who are brought, say, where did you pick this person? So we brought him from home. Okay? If it's a relative, you ask them, does he have any history of what? Epilepsy. Why are we asking that? Because there are certain medicines that we are going to give which may be contradicted in what? in epilepsy.
Okay.
So as you rule out that one, if there is no epilepsy, then then you can now go on.
Okay.
Mm.
So how, do you have treatments you're going to give afterwards?
Yeah, like because we have said this is a psychiatric emergency, we have also medicines that we use for managing psychiatric conditions. Okay, if you're having a violent and aggressive patient, the first thing you want to calm this person. How do you want to calm this person? By sedating them. Okay, by what we call rapid tranquilization. Okay, and those who are watching us, wherever from which country, but you can follow the right protocols from your country of origin, how to manage an aggressive patient. But this content is for educational purposes. So there is medicine that we always use for managing aggression and violence. Okay, there is a class which we call benzodiazepines, where we find a drug which is called diazepam. Diazepam is available in injection form. Then also we have what we call antipsychotics. Okay, you know, psychosis is a condition which has talking uncoordinated things, violent behavior. Okay, someone has delusions, like say maybe he's talking things that you don't understand. Says, I'm the president of this country, I'm the pope of this country, and when you try to oppose that individual, you find this person becomes irritable or aggressive.
Okay.
So we have drugs which you call antipsychotics. They are available in injection form, especially the first generation antipsychotics. We have chlorpromazine injection, we have Haldol injection. So when you're having a violent patient and you want to calm down the situation, the first thing you have to think of is chlorpromazine. Okay?
Yeah.
You think about antipsychotic and also a benzodiazepine. And diazepam is one of the drugs that are available. So you get diazepam, get chlorpromazine, you give this person injection, you give, maybe say you're giving IV diazepam, then you are giving IM what? Chlorpromazine. So when you give those people they give those medicines, the right dose to that patient, then that person, first of all we have said sedation. It will make that person to sleep.
What would be the right dose?
Okay. The right dose, it depends on their body weight. Okay, so as a health worker there, you check with your protocols, you calculate the amount of dose that you need to give to somebody. Then when you give that dosage, then that person will sleep. Okay. After sleeping, now you have calmed down what?
The situation.
The situation.
Okay.
Yeah. Now the next thing is, now you have someone is calm. Now you can go back to history and say, now ask the police officers. Okay. What happened? What was this person doing? Okay. He was behaving abnormally, was fighting, was cutting down over destroying property, beating, breaking glasses. So you now can have time to what?
To interact with them and
to take
find
what?
out. Okay, take the history.
Take the history.
Okay. Then you can also ask them about how this came about, the what intrigues the aggression.
Yeah. Now from there you can find out some of the factors that are causing that. And if someone is having epilepsy, we don't give the chlorpromazine injection. Why? Because when you give someone who has epilepsy, this one increases the number of seizures, the frequency of seizures.
Okay.
But we have another option whereby we give, you can give Haldol plus the diazepam.
But now, if us sensitize the community in case they are faced with the same situation, what do they do? Just briefly, 1 minute.
Yeah. If you're having a violent and aggressive patient in the community, first of all, someone who is aggressive and violent, you have to not to also reply by being aggressive. Okay, you have to find psychological ways of how you talk to this person. Do not also be rude, but talk to this person, listen to this person, what he's saying.
Yeah.
But also, you can call the neighbors, you can call the police to come and help you to rescue in such kind of what? Situation. Okay?
Okay.
Yeah. But as we have been talking, like these people can be violent, they can kill you, they can do anything. So we are saying that when you have such kind of this, ensure safety, removing those sharp objects, because the person can use them and kill you when their mental health is not what? Is not fine.
Okay. All right. Thank you very much, viewers. That has been violence and aggression, and these things happen in our setting. So be careful, and please subscribe, comment and like. Thank you all.